Hello, my name is Ileana Marrero, and now I'm going to go over the axial skeleton. So first off, we have the cranial bones. Right here we have the frontal bone. Right behind it we have the parietal bone, these two regions. Down below we have the occipital bone. And in the occipital bone we have the external occipital protuberance, and that's this little region here. And what it's for, it secures the back of the neck, and it's like a sheet-like elastic that connects the vertebrae with the neck as well. We then move on to the temporal, which is this area here, the temporal bone. And in the temporal bone, we have the temporal mandibular joint, which is this area right here. We then have the mastoid process, which is this pointy region right here. Next, we have the styloid process, and that is this little pointy part in here, the styloid. And then we have the external acoustic meatus, which is this little hollow part. And then we have the squamous part. So that's part of the temporal squamous part right here. I have the suture. In the internal view, the petrous part of the temporal lobe, what structures are housed within this part of the temporal bone? It houses the middle and internal ear cavities, contains sensory receptors for hearing and balance as well. The external acoustic meatus, this passes and transmits the cranial nerves. So the petrous part of the temporal lobe is in this region here. And then you have the internal acoustic meatus, which is in this little region here. So then we move on to the sphenoid. For the external view, we find the superior orbital fissure, which will be right back in here. And what passes through here, it allows the cranial nerves that control eye movement to enter the orbit. So then in the internal view, right like this, we then have the lesser and greater wing. So right up here we have the lesser and greater wing. Next we have the optic canal, and this allows the optic nerves to pass through the eyes, and that is, there's two little holes right here and right there. See them better. Next we have the sella turcica, and this is what structure sits in this. It's the hypophyseal fossa, and that is in this little region right here. Then we move on. So then we move on to the ethmoid. And here we have in the internal view the crista galli. What does this do? It helps secure the brain in the cranial activity. So the crista galli is this little thin line right here. It sticks out. And the cribriform plate. And this, what passes through the holes are the olfactory nerves pass through from small receptors and nasal cavities to the brain. And the cribriform is in this region right here, next to the crista galli. So we are now going to talk about the sutures. First off, we have the coronal suture, which is right above here. It's part of the frontal. Next, we have the sagittal, which is the one that runs right down here in the middle. And that is part of the parietal. We then have the lambdoid, which is this suture right above here, and that's part of the occipital bone. And then we have the squamous temporal. So that would start right here, part of the squamous, the temporal bone. So we now move on to the facial bones. First off, we have the maxilla, which is this area right above here. And then we have the alveolar process, which is right above the teeth, by the gums. And then we have the nasal bone, which is this bone right here. Next we have the zygomatic bone, which is this part right here. And this bone, the frontal bone and the zygomatic, is what forms the cheek. We then move on to the ethmoid, which would be right above here. And then right below it, we have the vomer. What two bones form the bony nasal septum? The vomer with the perpendicular plate of the ethmoid bone is what forms the vomer, and the inferior nasal concha would be right along this region here by the wall. And this forms the lateral walls of the nasal cavity. Next, move on to the mandible. And here in the mandible, we have the body. Next, we have the angle, which is this region right here. We then have the ramus, which is right in here. This part, right here. Next we have the mandibular condyle, and that is right in here, this part right here. We then have the mandibular notch, and that is this little arch looking right in here. And lastly, we have the coronoid process, which is this pointy area right in here. So now we're moving on to talk about the vertebral column. I'm going to be pointing out the 4 curves of the adult vertebral column. First off, we have the cervical, the lumbar, the thoracic, and the sacral. The primary would be the thoracic and the sacral, and the secondary would be the cervical and the lumbar. The cervical vertebrae, which is the first 7. These has the atlas, which is this top bone right here. And this articulates facets which receive the occipital condyles of the skull. In other words, they carry the skull. A range of motion would be nodding your head, yes. Next, what is unique about the transverse processes of all cervical vertebrates compared to those of the thoracic and lumbar vertebrae? It contains the transverse foramen through which vertebral arteries pass to serve the brain. So that's something that's unique about it. So for the thoracic vertebrae, there are 12, and I will be pointing out the following components of it. First, we have the sphenius process, which is this pointy bone right here. We then have the transverse process, which are these bones on the outer part. We then have the intervertebral foramen, and that is, you could see it on here. They're the little holes in between, and this allows the spinal nerves to pass through. We then have the body of the centrum, which is this region right here. And also we have the position of the intervertebral disc. So that's this region right across, and this is the body, the disc. Lastly, we have the lumbar vertebrae, there are 5 of them, this area here. And part of it is the sacrum, which is this region here, and there are 5. And also we have the coxia, which is right down here. That is known as your tailbone. Next we have the sternum, and that is composed of the manubrium, which is this top part. Next we have the body, it's a little longer region here. Then we have the xiphoid process, which is this pointy bone down here. And lastly we have the jugular notch, which is this little arch area right here. Lastly, we'll talk about the ribs. We have the true ribs, which are composed of the first 7, and the false ribs are numbers 8 through 12. We then have the floating ribs, which are these last 2 right here. They're floating. And next we have, I'll be pointing out the head, neck, and tubercles. So right inside here we have the head of the rib. Next to it we have the neck, and this longer area here we have the tubercle. It's a little hard to see there. So it says explain how ribs articulate with the vertebrae. Rib 1 and 10 through 12 articulate with one vertebrae body. Ribs 11 and 12 do not articulate with the vertebrae transverse process. And that's it.